innovation, academic excellence, and family-centered clinical care, Children's Mercy Kansas City is transforming outcomes for children around the world. Welcome to the audio interview series, Transformational Pediatrics, with host Dr. Michael Smith.
Our topic today, CHAMP Saves Lives. My guest is Dr. Haley Hancock. Dr. Hancock is a pediatric cardiologist, and she's the medical director for the Cardiac High Acuity Monitoring Program, which we call CHAMP. Dr. Hancock, welcome to the show.
Thank you.
So, tell us, in general, what is CHAMP, right, and why was it even developed?
Yes, so the Cardiac High Acuity Monitoring Program, or CHAMP, is a monitoring program for our highest risk patients, those with single ventricle congenital heart disease. And this program was designed for our most complex patient population, that single ventricle population, or patients with hypoplastic left heart syndrome. And they have a very high-risk period called the interstage period. This is the time that these infants spend between their first and second heart surgeries. It's about 4 to 5 months for them and for their family. And the Children's Mercy Heart Center's goal was really to decrease the morbidity and mortality in this patient population during a high-risk period.
Yeah. So between the first and second surgery, I think I saw some stats anywhere between 10 to 20% of these babies will die, right?
Correct. And it can range anywhere, 7 to 15%, up to 20%, like you said, for that interstage time period mortality. So that monitoring through that has been shown to be extremely important.
So tell us then a little bit. So we understand the need for this program, monitoring these acute babies during this very critical time. How important was the parents' role in all this, and the home monitoring role in all this?
Yes, so the parents' role is really, really important, and we know that these parents are extremely stressed. If we think about just taking a healthy baby home, that's stressful. So taking home a baby who's had a significant heart surgery, and we're looking to that next heart surgery at around 4 to 6 months, that time period is so crucial. And so we really have to support these families, and it's really important that they're engaged with something that works for them to be able to monitor what these patients are doing at home and to even be able to have them at home.
Yeah, so why don't we talk a little bit more about the specifics of CHAMP? Tell us a little bit about who's involved, the doctors, the nurses, the family, and tell us what exactly is involved. What are some of the aspects of this program?
Sure. So the program has really grown. It now includes 2 nurse practitioners, a nurse coordinator, a multi-site program coordinator, a dietitian, social worker, 2 physicians, a heart center technology team support, and it, the parents, what it is an application was created for this monitoring program on a tablet, and families are given this tablet. They're trained on this tablet by our team members, and they use that CHAMP application or tablet to provide us clinical information about these babies from home. They enter their heart rates, their oxygen saturation levels, which are crucial to know, their weight by home scales, their feeding intake, output, any concerns that they have, and they send us a daily 15-second video for us to see at baseline and any time that they have concerns.
And this is all done on a simple tablet, simple app. How have the parents accepted this? Is this something that they learn real easy? I guess, what kind of feedback are you getting from the family?
Yeah, so some parents can feel overwhelmed at first with the technology, and just they're overwhelmed in general and stressed with the care of these fragile babies. But I really think, the majority of these parents, and actually our group has shown this, we've looked at this in a study, they prefer the application over a traditional pen and paper or binder model. We know that we have to monitor all of these crucial things about these patients, so if they can enter it easily into an application that's sent directly to us, they don't have to make phone calls, all of those things, then they actually feel quite comfortable with this portable technology, particularly with the tablet.
Yeah, and so how long has the program been going on at Children's Mercy?
So it was started back in 2012.
So 2012, we're at 2018 now. What kind of results have you seen?
Yeah.
So again, just to remind the audience, we were talking about upwards of a 20% chance of, or 20% of the babies died, up to 20% died in that critical time period. What have you seen? Has this program reversed some of that?
Yes, it's been remarkable. Mortality in the CHAMP group of these patients has decreased to less than 3% for this group. So we know, again, that interstage monitoring is really important from data that we have from the National Pediatric Cardiology Quality Improvement Collaborative, or NPCQIC. And monitoring with this technology through CHAMP has decreased that mortality to less than 3%.
That's amazing, right? So Dr. Hancock, that's a great outcome of this program, CHAMP. Well, so
absolutely
are more hospitals adopting this program?
Yes, they are. So now the program has expanded to 9 centers across the nation who are using the CHAMP application, including Children's Mercy, where it started. We rolled out to other centers, and we kind of rolled out the application in 2014. And then we've seen since about around early 2017, we've had 7 more centers come on board. So we're really growing fast. We're covering patients in about 16 states over the nation.
I listened to all this and how you describe CHAMP, and it makes perfect sense, right? I mean, we're increasing our monitoring of these children. The parents are involved. Outcomes get better. Do you see a program like this being extrapolated to other disease states? I mean, is this a model maybe for how we can monitor many other critically ill babies?
Yes, absolutely. We're thinking about it for even other populations within cardiology that are high risk, but not necessarily single ventricle. And then I really think it has an application for pediatric patients with complex disease who we'd like to have at home, but need, extra monitoring from their healthcare providers. And they can, through this application, still be monitored by their healthcare providers, but be at home with their families.
Dr. Hancock, in summary, what would you like people to know about CHAMP?
Yes, I think it's so exciting, and it takes a lot of support and amazing people to make something like CHAMP work, and it's truly saving lives, and I believe it's improving the quality of life for our patients and families.
I think so too. Well, and the proof is you decrease that number, that percent that babies died, up down to 3%. That's fantastic, and I'm really happy to see
Absolutely.
that this program is being adopted by other medical centers as well. Dr. Hancock, thank you so much for the work that you're doing at Children's Mercy, and also thank you for coming on the show today. You're listening to Transformational Pediatrics with Children's Mercy Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.